Good morning. Today we shall discuss about a case who presented himself to the dental office with the complaint of soreness, redness and burning sensation in the palatal area. He was a denture wearer. Upon examination of the oral cavity, you observed these findings. The palate was intense red. There were inflamed swollen mucosa in the mid-palatal area in the form of dots. The denture hygiene was poorly maintained. The red inflamed area was clearly demarcated by the outer border of the upper denture. The posterior palatal seal area was clearly visible. The uncovered fovea palatini and surrounding areas were normal in look. You have to perform the following task. Number 1, you have to make the clinical diagnosis. Number 2, you have to tell the reason as to why only the microbiological culture will not be diagnostic. Number 3, what will you do to confirm the diagnosis? Number 4, what is the treatment plan? And number 5, what should be done to prevent the recurrence of the disease? Answer of the question number 1 is, the palatal area is intense red with burning sensation and soreness of the mouth. It is clearly demarcated by the boundaries of the maxillary denture. It seems that the dentures have not been often removed for the purpose of the rest of the palatal tissues and maintenance of the denture hygiene. Therefore, based on the findings presented, the first clinical diagnosis coming out is denture stomatitis, which is also known as acute erythematous stomatitis. Answer of the question number 2 is, the microbiological culture can demonstrate the presence of Candida species, but not the active infection status. Answers of the questions number 3, 4 and 5 have been combined. The diagnosis is confirmed by the positive response of the treatment provided to the patient with antifungal agent and denture hygiene instructions. Antibiotic therapy should also be instituted as oral candidiasis is often accompanied by the bacterial infection. To conclude, the denture stomatitis caused by oral candidiasis that is often accompanied with bacterial infection. Therefore, it should be treated with a suitable antibiotic too after bacterial culture and sensitivity test along with antifungal therapy. Since most denture wearers are older persons and may have diabetes mellitus and may be immunocompromised, therefore the patient should be checked for diabetes mellitus and appropriately referred if needed for the appropriate glycemic control.
Up at night, yeah. Make all the demons quiet, yeah. We